Today we'll do a very interesting topic, which is the ACE inhibitors. Now, what are ACE inhibitors? Those are the drugs that prevent formation of angiotensin 2 and lead to relaxation of arteries. In a general view, I'm telling you what are ACE inhibitors drugs. Now, coming on to why do we use them? We can use them in a number of cases like congestive heart failure, hypertension, scleroderma crisis, prophylaxis of cardiac disease, then diabetic neuropathy. Now, how do these ACE inhibitors actually work? What is the mechanism of action of this capsule of ACE inhibitor? The mechanism of action is it inhibits conversion of angiotensin 1 to angiotensin 2. Then it also affects the bradykinin. It causes inactivation of bradykinin. Then it reduces aldosterone cause specific renal vasodilation. Coming on to another, pharmacokinetics. It is to be understood that all of them are present in an inactive form in the body at normal conditions, but the captopril and lisinopril are active. So all are orally available. Then some of them undergo hepatic conversion. Like lisinopril. Then enalapril is the only ACE inhibitor which is available intravenously, and they can be metabolized completely. Some captopril. Lisinopril is drained out in urine unchanged. Coming on to the drug interactions. With allopurinol, they show a hypersensitivity reaction. With anesthesia, they show reduced hypo effect. Then with cimetidine, they show neurological disorders. Then with insulin, they show hypoglycemia, increased toxicity of lithium. Now, what will happen in case you take a large amount of them, or what are the adverse effects that could possibly happen in a person taking ACE inhibitors? The first one is a very important and a very common symptom, which is brassy cough. Then we can see angioneurotic edema. We can get to see maculopapular erythematous rashes. We can also get to see, certain GIT manifestations like nausea, vomiting, dyspepsia. You can get hypokalemia. We can see hypotension. We can also see along with it dysgeusia. Then if it is administered in the second or third trimester of pregnancy, we can see certain fetal abnormalities as well. Fetal abnormalities. Second and third trimester maladies. These are the adverse effects. Now coming on to the another class, which is the angiotensin receptor blockers. This contains basically all the sartans: losartan, quensartan. The drug will end with sartan. Okay. Now what do? They directly block the angiotensin receptor. That is, they block the type 1 receptor. Now what happens is, there is no involvement of RAS, bradykinin. It is a very clear way of doing the same thing. We can see that it is used in hypertension in those individuals who are either allergic to the angiotensin ACE inhibitors, or we can also see that there is a reduction in side effects. Plus we can use it as an alternative in the congestive cardiac failure or the diabetic nephropathy. Now in direct renin inhibitors, we have allopurinol. What it does is, it directly blocks the renin. In this, there are no side effects. Here you have side effects like fever, vomiting, headache. So this is the direct renin inhibitor, allopurinol. It is directly blocking the renin, which in turn shows no side effects. But however, it is quite long acting. It is a non-peptide, orally taken. In this, liver cirrhotic patients can be given ARDS. So this is it. It does not have such much of a specific advantage, but however it can be used as an alternative. It also had side effects like the mentioned above. So this is it.